Hello, I'm Dr. Amir, your online health physician. Today we will discuss malaria. Doctor, what is malaria? Malaria is a life-threatening disease caused by a parasite transmitted through the bite of infected mosquitoes. It causes symptoms like fever, chills, and fatigue. Prompt diagnosis and treatment with antimalarial drugs are essential. Malaria is a significant global health issue, primarily affecting tropical and subtropical regions. Doctor, are there different types of malaria? Yes. There are several types of malaria, including Plasmodium falciparum, Plasmodium vivax, Plasmodium malaria, Plasmodium ovale, and Plasmodium knowlesi. Plasmodium falciparum is the most severe and responsible for most malaria-related deaths. Each type has distinct characteristics and may require specific treatment approaches. Doctor, what are the signs and symptoms of malaria? The signs and symptoms of malaria include fever, chills, sweats, headache, body aches, fatigue, nausea, and vomiting. Other possible symptoms include anemia, jaundice, enlarged spleen, and respiratory distress. It's important to note that symptoms may vary depending on the type and severity of the infection. Doctor, what is the first aid for malaria? First aid for malaria includes seeking immediate medical attention. If medical care is not readily available, individuals should rest, stay hydrated, and take over-the-counter fever-reducing medications. However, it is crucial to emphasize that proper medical diagnosis and treatment by healthcare professionals are essential for effectively managing and treating malaria. Doctor, what is the effect of malaria in pregnancy? Malaria during pregnancy can cause maternal anemia, low birth weight, preterm birth, stillbirth, and neonatal mortality, and increase the risk of maternal complications such as severe anemia and preeclampsia. Doctor, what are the precautions for malaria? Precautions against malaria include using insecticide-treated bed nets, applying mosquito repellents, wearing long sleeves and pants, avoiding outdoor activities during peak mosquito times, and staying in air-conditioned or well-screened accommodations. Additionally, taking antimalarial medications as prescribed and staying informed about the risk of malaria in specific areas are important precautions to consider. Doctor, what is prophylaxis of malaria? Prophylaxis of malaria involves taking antimalarial medications before, during, and after travel to areas with a high risk of malaria transmission. The specific medication and duration of prophylaxis depend on the destination, individual factors, and the type of malaria prevalent in that region. It is important to consult with a healthcare professional for appropriate prophylaxis recommendations. Doctor, what is cerebral malaria? Cerebral malaria is a severe complication of malaria that affects the brain. It is primarily caused by Plasmodium falciparum infection and can lead to coma, seizures, altered mental state, and neurological damage. Prompt medical intervention is crucial, as cerebral malaria can be life-threatening and requires intensive care treatment. Doctor, what is the difference between malaria and dengue fever? Malaria and dengue fever are both mosquito-borne diseases but are caused by different pathogens. Malaria is caused by the Plasmodium parasite, while dengue fever is caused by the dengue virus. Malaria typically presents with recurrent fever, while dengue fever is characterized by high fever, severe headache, joint pain, and rash. Doctor, why does malaria cause anemia? Malaria can cause anemia due to several reasons. The Plasmodium parasite infects and destroys red blood cells, leading to their depletion. Additionally, the parasite stimulates the immune system to release chemicals that further contribute to the destruction of red blood cells, leading to a decrease in hemoglobin levels and anemia. Doctor, is there any vaccine for malaria? Yes, there is a malaria vaccine called RTS-S/AS01, also known as Mosquitoes. It has been developed to provide partial protection against Plasmodium falciparum malaria, primarily in young children. However, its effectiveness varies, and it is not yet widely available or used as a routine vaccination in malaria endemic areas. Doctor, what is the clinical test for malaria? Clinical tests for malaria typically involve examining blood samples. The most common tests include microscopy, where a trained technician examines a blood smear under a microscope to identify the presence of malaria parasites, and rapid diagnostic tests, which detect specific malaria antigens in the blood. Polymerase chain reaction, PCR, is a more sensitive test used for confirmation and species identification. Doctor, what are the side effects of the malaria vaccine? The malaria vaccine RTS-S/AS01, or Mosquitoes, can cause side effects such as pain, swelling, or redness at the injection site. Other potential side effects may include fever, headache, fatigue, gastrointestinal symptoms, and allergic reactions. It's important to consult with a healthcare professional for detailed information and guidance on the specific vaccine's side effects. Doctor, what diet should I take if I suffered from malaria? If you have suffered from malaria, it is important to focus on a balanced diet to aid in recovery and restore nutrient levels. Include foods rich in iron, such as lean meats, leafy green vegetables, and legumes. Also, consume a variety of fruits, vegetables, whole grains, and proteins to support overall health and immune function. Thank you, Dr. Amir. It was excellent knowledge about malaria. Wish to see you on another health topic. Before saying goodbye, here are the health tip for you. Prevent malaria, use bed nets, mosquito repellent, take antimalarials, seek treatment for symptoms, and eliminate mosquito breeding sites.
Hello, I'm Dr. Amir. Welcome to our online health lectures on different health topics and a quick review. Please subscribe to the channel and let's embark on a journey towards a healthier you.